Reuters published some very interesting information about healthcare costs recently. And this is from Reuters. The cost of U.S. healthcare services is expected to rise 7.5% in 2013. That's more than 3 times the projected rates for U.S. inflation and economic growth. Listen up, this is important. Now, premiums for larger employer-sponsored health plans, like big corporations, could increase by only 5.5% as supposedly a result of company wellness programs. By the way, I've yet to see solid evidence that these programs are actually effective in anything. And maybe they're not growing as fast because of a growing trend towards plans that impose higher insurance costs on workers. You may know about this already. And that's really what I think will hold down corporate costs, because they're shifting the costs to the employee. This, according to a report by the accounting firm PricewaterhouseCoopers. The projected growth rate of 7.5% for overall healthcare costs contrasts with expectations for growth of only 2.4% in the U.S. domestic product and 2.0% rise in consumer prices during 2013. You know what that means? It's costing more for healthcare than it does for inflation when combined even with the slow growth of our economy. Healthcare costs have long been known to outstrip economic growth and inflation rates, driving up government spending on programs such as Medicare and Medicaid at a time when federal policymakers and lawmakers are wrangling over how to trim the U.S. budget deficit of $1 trillion a year. So prices are going up a lot, and yet they're trying to figure out how to cut them down. But the research suggests that data for the past shows an extended slowdown in healthcare inflation from earlier decades when annual costs rose by double digits. Used to be 10, 11, even 12% increases in the cost. Now, according to a number of people, we're in the early beginnings of a shift toward consumerism in healthcare. That means where you get more responsibility, and they think that you'll see more of that in the coming months and years. That's according to the managing director of the Health Institute at Price Waterhouse. Now, more than half of the 1,400 employers that were surveyed in this study are considering increasing their employees' share of health benefit costs and expanding health and wellness programs in 2013. That means you're going to pay more and you're also going to get less. You're going to have higher deductibles. You're going to have health savings accounts, HSAs. You already know about this. Just look forward to more of it. Now, they feel that health plans in general with higher deductibles and copays for workers tend to dissuade unnecessary purchases in terms of health expenses and offer lower premium costs for employers, not employees, for employers. While successful wellness programs can reduce the need for medical services, I think that's absurd. But I'll explain that to you in a minute about the wellness program. The report said that prospects for higher growth are also being held back by the consolidation of hospitals and physician practices, no question about it. Lots of practices are going down the tubes. They're being bought out by hospital institutions because insurance industry is pressuring hospitals to cut their expenses, and because of a growing variety of primary care options such as workplace and retail health clinics. No question about it. Walk-in clinics. I didn't say better care. I just want you to understand that if you go in like to a pharmacy and you see a nurse in a box and you know they give you a little buzzer and then you get to see them for your sore throat, I don't think it's better care. But I do think they're right. It will cut costs. And, of course, the other thing that will cut costs supposedly is generic drugs, although we're now seeing a dramatic increase in the cost of many generic drugs. At any rate, upward pressure on healthcare costs comes in part from a rebounding economy and the growth of new medical technologies, including robotic surgery, nuclear medicine, imaging, and you've heard of it, positron emission tomography, PET scans, et cetera. The projection of this 7.5% growth is nearly double a 3.9% rise in U.S. healthcare spending that the federal government says occurred in 2010, the last year for which official figures are available. The government survey includes Medicare and Medicaid spending, as well as the over-the-counter pharmacy purchases, while the report focuses on the private insurance sector of the $2.6 trillion U.S. healthcare system. Okay, now, let me put my spin on this. First of all, Costs are still climbing at alarming rates, so we haven't addressed the healthcare financial crisis. Don't even think we have. I do not believe that wellness programs have done as much as evidenced by the fact that we're still getting a nation that's getting fatter and less healthy, and I don't see them having made any difference. This is nonsense spin from so-called disease management and wellness companies that make industry think that it's worthwhile wasting money on these programs. If we cut them out, it would save money for you. If you want to save even more money and you want to cut out these programs, you should be talking to your insurance company, your employer, that you'd rather have not as much expense in your health care and get rid of these programs which don't do anything anyway. Now, making people share more of the cost of care, that's not such a bad idea. I hear more and more people who used to say, you know, Doc, I want that test because I read about it. They didn't care the cost. Now they say, do I really need that test? After all, I'm paying a big slice of it because of my bigger deductible. This results in fewer tests, procedures, drugs, but it also is better for patient because less useless medicine means better health. Here's the kicker. The Obama Affordable Health Care Act will bring in 30 million more folks into the medical system, and everyone, except the friends of the Democratic leader of the House, Nancy Pelosi, have to pay for medical care. You will pay for your medical care and the medical care of others who can't pay for it. I'm not getting into the debate as to whether we should or should not do it, but please do not kid yourself. Health care costs in 2014 are going to go up because when this stuff kicks in, it's going to skyrocket. There's 30 million more people. I want everyone to have medical care. I do. However, since the Congress wasted all of our money when times were good, can we afford, especially with these great fiscal managers of your money, can we afford affordable health care, Obama style? This is Dr. Sam Benjamin with Medical News you can use.